मंडळी, नमस्कार मंडळी. मी रवी कुलकर्णी, मी प्रकाश लोथे यांची आज ओळख करून देणार आहे. ओके. प्रकाश इज अ गुड फ्रेंड ऑफ माइन फॉर लास्ट 35-40 years. आणि आज मी त्यांची ओळख करून देणार आहे, ते मित्र म्हणून ओळख करून देणार आहे. पण प्रकाशचं व्यक्तिमत्व अष्टपैलू व्यक्तिमत्व आहे. प्रकाश एक तर चांगला मित्र आहेच आहे, पण त्याच्याबरोबर ही इज ऑल्सो अ मेडिकल डॉक्टर. आणि रोज सकाळी 6:45 वाजता प्रकाश श्रीयोगाच्या प्राणायाम क्लासला नेहमी हजर असतो. कधीही 7 दिवस कधीही मिस करत नाही. तर प्रकाश, मी आधी सांगितलं होतं की प्रकाश व्यवसायाने मेडिकल प्रॅक्टिशनर आहे, म्हणजे पेडिट्रिशियन आहे. न्यूजर्सीमध्ये जवळजवळ 35-40 वर्ष प्रॅक्टिस केली आणि नंतर गेले 3-4 वर्षापूर्वी व्हर्जिनियामध्ये मूव्ह झाला. ओके. आणि मुख्य म्हणजे प्रकाश इज अ व्हेरी गुड रायटर. त्यांनी रेग्युलरली 1973 पासून खूप खूप शॉर्ट स्टोरीज, एसेज, नॉव्हेल्स, स्क्रीन प्लेज हे सगळे त्यांनी पब्लिश केले आहे. आणि त्यांची मोठी नॉव्हेल आहे धर्मधुरीण, ही मराठीत त्यांनी लिहिली आणि नंतर डिफेंडर ऑफ फेथ त्याचं इंग्लिशमध्ये ट्रान्सलेशन झालं. आणि ती नॉव्हेल त्यांना महाराष्ट्र गव्हर्नमेंटचं मोठं प्रशंसनीय बक्षीस मिळालं. आणि त्यांचा जो स्क्रीन प्ले होता तो मूवी मध्ये सुद्धा कन्वर्ट झालाय. तर आत्ताच प्रकाशने बराच अभ्यास करून अ प्रिस्क्रिप्शन फॉर हेल्थ अँड हॅपीनेस हे अमेझॉन कडनं पुस्तक पब्लिश केलंय. आणि आता प्रकाश बिंग अ मेडिकल डॉक्टर, तो he gives the interpretation of yoga shastra sutra of Patanjali from medical perspective point of view. ओके. तर म्हणजे मला असं वाटतं की प्रकाशने जे पतंजली योगसूत्र लिहिलं आहे आणि त्याची जी मेडिकल सायन्सशी त्याचं जे कोरिलेशन केलं आहे ते आपल्या सगळ्यांना त्याचा उपयोग होईल. ओके. तर आता मी प्रकाशला रिक्वेस्ट करतो की या पुस्तकाबद्दलचं पर्स्पेक्टिव्ह त्यांनी आम्हा सगळ्यांशी सांगावं अशी त्याला विनंती करतो. प्रकाश, ओव्हर टू यू.
नमस्कार. त्या पुस्तकाचं नाव आहे प्रिस्क्रिप्शन फॉर हेल्थ अँड हॅपीनेस, दी योगसूत्राज ऑफ पतंजली. आणि उद्देश असा की पतंजली योग यातले जे मुख्य भाग आहेत, आसनं, प्राणायाम आणि मेडिटेशन, याला आधुनिक वैद्यकीय शास्त्रात काय आधार आहे हे पाहण्याचा मी खूप प्रयत्न केला आणि त्यातून बरंच काही सापडलं. म्हणून या पुस्तकात मी त्याचा अंतर्भाव केला आहे. याच्याशिवाय पतंजलीची 196 सूत्र आहेत, त्याच्यावर छोटी छोटी कॉमेंट्री लिहिली आहे आणि त्याला सोप्या शब्दात सांगण्याचा प्रयत्न केला आहे. तर मी आज जे बोलणार आहे त्याच्याशी बराच संबंध आहे, पण आज आपण फोकस करणार आहे ते ओनली न्यूरोसायन्स ऑफ मेडिटेशन या भागावर, कारण पूर्ण पतंजली योगसूत्र यात कव्हर करण्यात का वेळ नाही. तर ओव्हर टू अनघाताई. अनघाताईंना आणि रवीला मी मनपूर्वक धन्यवाद, सायलीताईंना मनपूर्वक धन्यवाद देतो. त्यांच्यामुळे आज या कार्यक्रमावर मला येता आलं आणि मला काही वाटतं ते पॅशनेटली जे वाटतं ते तुमच्याबरोबर शेअर करण्यात मला खूप आनंद होतो आहे. तर याकरता पुन्हा एकदा अनघाताई, सायली आणि माझा प्रिय मित्र रवी यांना मी धन्यवाद देतो.
अच्छा. अरे नमस्कार मंडळी. वेलकम टू दिस प्रोग्राम. आणि आपल्याला फार अतिशय उपयोगी आहे. आणि ही इज गोइंग टू एनलाइटन अस टुडे ऑन इम्पॅक्ट ऑफ मेडिटेशन ऑन आवर ब्रेन. And it will help us to slow down or prevent the onset of and progression of many disorders like depression, Alzheimer. So before that, since it is on meditation, let's look at briefly why we meditate and what is meditation. तर जॉन कबर्ट झिन जो आहे, हू इज अ फर्स्ट पर्सन ज्यांनी त्याला सायंटिफिक बेसिस मेडिटेशनला दाखवलं आणि देन होल अमेरिका गॉट इंटरेस्टेड इन मेडिटेशन. तर तो म्हणतो मेडिटेशन म्हणजे काय, इट इज सिम्पली नॉट मिसिंग आउट ऑन आवर लाईफ. कारण काय, तर वी आर कॉन्स्टंटली डिस्ट्रॅक्टेड, म्हणजे टी व्ही, फोन, and in addition we self-distract ourselves, just daydreaming, imagining future and planning or regretting. So we are never present in most of our life. Meditation is focusing on the present moment. That's where the life really happens. तर मग, if you prefer, close your eyes or gaze down. Focus gently away from your feet. Take a deep, full breath and exhale slowly, allowing body to relax, keeping mind alert. Take another deep breath. Exhale again slowly, scanning the body from the crown of our head to the feet. Let all the stress and tightness go down and dissolve in Mother Earth. Let go, let go, let go. Bring your attention to the body. Feel the air outside and inside of the body. On your face, on any part exposed to the air, just try to sense that you are in the ocean of air called atmosphere. Now take the focus to your nostrils, the most important part of the body, the part that is always drinking air. Air with in-breath and just exhale with out-breath, cleaning up our body, sending the air back. Just think, we are just one breath away from death. Actually, just think, are we doing the breathing or it is being done for us? If it is left to our mind, which is always taking off, we would have been dead long time. It shows how important it is to be aware and focused on the present moment. So help the mind stay focused on your breath, on the present moment. Eventually, mind will take off. Just gently bring it back to the area of your body where you feel breath most. Basically, we are training the muscle of focusing and stabilizing our attention. As you focus doing meditation, we realize how distractive our mind is. At times, we are taken away from the stream of thoughts and we are far away from our body, sitting and breathing. It's okay. Just bring your attention back. Your body has not taken off. The breath is always happening. Meditation trains you to reside in the body, reside in the awareness of breath, being present with each moment of life. You have chosen to be here. Then why not be here 100% without having any agenda? Just stillness. And if you look at it, reflect on it, it is not the object of attention that is important, that is most important. What is most important is to be focused and aware of the present moment and the next moment and the next without getting attached, without grabbing, planning. It is the meditation that gives you this superpower of human awareness. It helps you to take action that supports your body and brain. In this way, whole life becomes meditation. With this awareness, stay focused on the presentation, which is the prescription for health and awareness. So stay with this thought for a minute before you open your eyes. It's a mistake, as usual. Yes, silent. So, 1 minute. Yeah, you can talk out. It's up to you, Dr. Lothe, 1 minute. Just I had to get out and come back again. One. This is what the mistake I always do, Shaili.
Dr. Lothe, you can start talking.
त्यांचं फ्रीज झालेलं दिसतंय सायली.
हा. मला वाटतंय अनघाताई also has left. She will join again.
रेकॉर्डिंग बंद करून पुन्हा स्टार्ट करते का?
Can
Resume.
start.
अच्छा. तर मी प्रथम तुम्हाला थोडंसं न्यूरोलॉजी सांगणार आहे. ब्रेन, त्याचं फंक्शन, कनेक्शन्स, म्हणजे पुढे मी काय सांगणार आहे त्याचा संदर्भ लागेल. सो द फर्स्ट स्लाइड इज Vedantic concept of the human organism. Let's go to the first slide. That number 2, slide number 2. Okay. Give me slide number 2. Good. See, what are we? Me कौन है? Are we body, mind, intelligence, or something else? So the concept of our human organism is that the outer part is physical body. The physical body is called Annamaya Kosh, and in English we call it anatomical body, which is made up of like your skin, bone, blood, all the fluids, and inside it is the functional energy we call Pranamaya Kosh. And you know there are 5 pranas: Prana, Apana, Vyana, Udana, and Saman. But most of the times modern medicine has stuck to the physical part of the body too. And that has actually handicapped modern medicine to significant extent. The second part is the functional energy, which particularly, our Ayurvedic medicine does address this functional energy because it is in our whole system of medicine and philosophy. The third is the psychological body, Manomaya Kosh. Inside, it has the Vijnanamaya Kosh, intellectual body, and then the blissful body, Anandamaya Kosh and Chittamaya Kosh, which is our soul. तर हे तुम्ही लक्षात ठेवा. जेव्हा आपण बऱ्याच when we deal with a lot of medical diseases, okay, we are just dealing with the outer course, which of course is not right. And a lot of diseases I'm talking to you today is right between the second and the third course, the Manomaya course. When the mind is outwardly directed, it suffers from a lot of things. And the whole idea of meditation and our Vedantic philosophy is teaching you to turn inward. The first part is called, in medical terms, it has no meaning, but in Vedantic terms, it's called Bhogavargi. Most lower animals are Bhogavargi. They are focused outward. Only the human being is Apavargi. Apavargi means directed towards moksha, inside. Okay, next slide. Hey, laksha theva, I will come back to this later. Next to the next slide. Okay. Somebody is asking for the full screen if that is possible. You all know Patanjali Yoga says that meditation is the most important part of our Patanjali Yoga, and other three are just to purify the thing. The physical body is purified by asanas, the functional body is purified by pranayam, and the innermost is by meditation. And it has three limbs: dharana, dhyana, samadhi. These are the three of the 8 limbs of Patanjali Yoga. Next one. Okay, I've just mentioned that first 5 limbs are to purify the outer layers, so that you, Sadhik, in simple terms, between you and me, see, it means that unless your body is healthy, you cannot concentrate on meditation. You will agree with me that. Okay, so we go back to the slide, which is the before that. Before, let's go back. Huh? Let's go back to the slide number 6. No, slide number 4. Okay, let me stop. Go back one more. Back types of meditation. You know the types of meditation. What we just tried, I think, is a mindful meditation. And go back, please. We are too far ahead. Now back, 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 backward, backwards. Okay, now go down to slide number 4. Go back to
अनघाताई,
slide number.
स्लाइड नंबर 4 ला जायला सांगितलंय. हे जे आलंय ना ते तुम्ही एक्स आउट करा. हे थँक्यू फॉर युझिंग सबटायटल्स. हॅलो अनघाताई. हा, हे एक्स आउट करा तुम्ही. थँक्यू फॉर यूज. हे आता जी विंडो उघडली ती एक्स आउट करा.
So this is the gross anatomy of brain. The most front is the frontal lobe, and the most part of the frontal lobe is called prefrontal cortex. That is the CEO of our whole body. It makes decision, it weighs pros and cons, it executes all the functions, and controls everybody else. Behind that is the parietal lobe, which is around here. Then around here, the temporal lobe is around the ear here, and occipital lobe is here. Here is your vision center, and here is, in this area, is your hearing center. Okay, let's go to the next one. Good. This is just how the brain is composed. The brain is made up of approximately 100 billion neurons. Neuron is a cell, nerve cell, and a nerve cell is a structural and functional unit of brain. And I said human brain has approximately 100 billion neurons. A chimpanzee has about 70 billion, and gorilla has 60 billion neurons. And the difference is the neocortex. I will tell you what is a cortex. See, this darker part of the thing is gray matter. The gray matter is full of neurons, and the white matter is its axon. We will go to the next slide. I will tell you what is an axon. Neuron is a cell, highly specialized cell, one of the most specialized cell in the universe. These other parts of the cortex. The neocortex, neo means new. Neocortex, because it is not present in uh, lower animals. So it is the latest part in the evolution. And as you can see, the now I'll tell the color. So this brown part, which looks like a chocolatey color, is association cortex. I'll tell you what is that. But behind that is a magenta color strip. It's called motor cortex. It has neurons which actually tells the whole body to move different limbs. A neuron will trigger an electrical signal, and it ends up into your hand, and you can actually move the finger. For your finger, there are maybe about 100,000 neurons dedicated just to do that function. Okay, the one behind that is a dark blue called sensory cortex. Sensory cortex means, suppose I touch you and stick the needle into you. Okay, this is the part where the finally sensation is recorded. Okay, it comes through a long track called a sensory tract, and it ends up in thalamus, which is underneath here somewhere, and then thalamus, it goes to here. All parts are connected. there are tracks, these millions, billions of neurons. They are connected from each other, from back to front and down to all the way to the spinal cord and down, and then also with the other hemisphere, because your brain has two parts, right hemisphere and left hemisphere, right? Okay, now you see this here, it says primary auditory cortex, the green one. This is right here somewhere. This is our area where you appreciate the what they call a uh, uh, speech that is heard. And then this is the visual cortex. See this visual cortex, this dark red area, that is the vision. That's where your vision is appreciated. It's very different than seeing. Your eye is just a camera, and the cortex itself is a thing, that computer that will interpret the signals. And this is surrounded by what they call as higher order neurons. What are the higher order neurons? That is the association cortex. These neurons are highly specialized, like a primary care doctor and a specialist doctor. Now, what are they doing? They appreciate color, shape, form, and the whole thing together. A simple analogy would be like you saw Madhuri Dixit. First thing, it is recorded as a woman. You figure out that is a woman. And then you see the features. And then you see her features like the eyes, mouth, nose. And sometimes just by looking at the eyes, you say, oh, this is Madhuri Dixit. So that comes from here. On the other hand, here is the auditory cortex. All the areas in the brain are full of nuclei. What is the nucleus? This nucleus is different from the cell nucleus. A nucleus is a collection of neurons dedicated to a specific function, like facial nerve nucleus means it will just control the facial nerve which comes to the face. So all these, now this auditory cortex, going back to it, suppose you heard a sound, but analyzing the sound is very different, and it is done by higher order neurons which are surrounded by this. In lower animals, like who depend upon hearing, such as a deer or a monkey in the wild, this is highly developed, better than us. But us is developed per se. You can distinguish Western music from Indian music. You can distinguish a rock music from a country music. That is our specialist neuron all around it. Okay, let's go to the next slide. Good. Okay, now this is the very important part, which I'm going to refer again and again. And this is related to the diseases of anxiety neurosis and depression. So remember this is a limbic system. Limbic system is made up of hundreds of nuclei, but important part of it is the hypothalamus, and there is a cingulate gyrus, part of this brain called prefrontal cortex. I told you the most front part of the frontal lobe is a prefrontal cortex, which is the most important thing in the brain. That, and this is called a nucleus accumbens septi. Never mind the name. This is responsible for addiction to everything, drugs, alcohol, sex, food. This is the thing. And then there is little one called hypothalamus. This is the master of our endocrine system. We will come to that later. And this is the cingulate gyrus. These are parts of the limbic system. The limbic system is responsible for our emotions, our learning, and memory. The most important, memory. And there is a thing that you see this. This is blue thing, the blue semicircular thing. Okay, that blue semicircular is a hippocampus. It is responsible for our memory. There are two hippocampuses. Hippocampus means, hippo means horse. It really looks like a seahorse. So there are two seahorses coming like that. And the left one remembers all the data, and it says the left hippocampus writes your autobiography. Suppose I decided to write my autobiography. I remember all the events in my life, right? And that is stored there. And with the help of the prefrontal cortex, you write your autobiography. Okay, next one. Next, please. This is the neuron. This is, remember this neuron, okay? It's a cell. That red spot in the center is the nucleus. And then, this long tail, that is the axon. Now, axon is the one that communicates with the other neurons. And how it communicates with that? See, at this point, it's called axon hillock. There, electric potential is created. This electric potential is created by movement of sodium and potassium ions in and out of the cell, and it is communicated all the way down like an electrical signal, like a telegraph wire or telephone signal, and it goes to the next neuron. Okay, and let's go to the next one. Next slide, please. See this? This is one neuron communicating with the other neuron or a dendrite. You saw that nerve cell that has got little projection, which were projections, they are called dendrite. So this is communicating with the dendrite. See this one axon communicating with the dendrite. And what is the space between? This space is microscopic space, and from one neuron, from axon, comes the signal. Here, electrochemical processes occur, movement of calcium ion inside, and these little tiny little dots, they are actually a vesicle, and each vesicle has a transmitter. A transmitter like a serotonin. You will hear that all the time, because all the antidepressant drugs, all the drugs that they use in neurosis and thing, serotonin is the name that they know. The serotonin is a good feel-good enzyme, neurotransmitter. It is transmitted from one to the other, and then this way electrical impulse gets transmitted. See, remember this thing. Suppose I do just this thing movement, this movement. Okay, some neurons in my brain are firing, and they are sending the signal. They are sending the signal through the whole brain to a track called pyramidal track. That nerve track, these axons go all the way, they cross into my neck and then go to the other arm. They give signal to my finger and says flex, bend, make it straight. And so I do this movement. So this is the whole thing is controlled there. Now, who tells the neurons to do this? That is not known to medicine, but it is known to Vedanta. Let's go to the next one. Yes, the next one, please. Okay. So next one, please. You see this? These are the part of the brain most activated by meditation. Now, how do they know? See, about 30 years, 40 years ago, people did not know all these things. Only way to learn more about brain is when somebody has a tumor and they lost the function, they know that, oh, lost function, that means this part of the brain must be affected, and that is controlling that function. Or somebody dies and you quote upon the thing, or animal experiments. But today we have this amazing technology called functional MRI. And this is a picture of a functional MRI. Not literally, but this is a little dramatized. Okay. And these other parts are activated by, and look at this prefrontal cortex, medial temporal lobe, that's where your limbic system is, and that's where the hippocampus is. Okay, see this orange color part? Okay, remember this thing. Okay, go next. Next, please. Okay, see, this is the part of the brains which actually are lighted up when I do simple movement like touching my fingers together. Okay, how do you see that? Actually, the blood supply of that part of the brain is increased when I do this thing, and that is picked up by the MRI. Okay, and sometimes it is the oxygen uptake, like the part of the brain which is active will take more oxygen, right? And so that part is recorded by the MRI. So oxygen uptake of the brain changes when different activity is done. When you are thinking, your brain is working, right? So that part works out. But what happens during meditation, that is the beauty. In meditation, after the whole body is shut off. That means you are not, your muscles are relaxed. Your body, your stomach is not digesting food, right? Your heart slows down. Your breathing slows down. Like Anagat, just told us how to do it. And you know, you're breathing much slower. Normally you breathe 10, 15 times. And here you breathe 2 times a minute. So all this energy, where does it go? The blood that is going to your lungs, to the intestines, to the stomach, is not going that much. It is going because you are alive, but it goes to your brain. And what does it do? It enriches the brain. Actually, preferably, it goes to the part I showed you last slide, which was a prefrontal cortex and the limbic system. And what does it do to you? A lot of good things. It builds more synapses. Synapses connection means like a loading up apps on your computer. Okay, you are born with billions of cells. It's like a computer you brought from Costco, right? Then you are every day you are putting photos, pictures, documents, new apps on it. And these days these computers are so smart, huge memory, and you all your life this is what you are doing, adding new input into it. Okay, and whenever you do that, the cell number of the 100 billion cells, neurons, is not going to change after the age of 3. Only the synapses change. Every neuron may have as much as 1000 synapses. Imagine 100 billion cells multiply by 1000 synapses, how many synapses there are. And each synapse means a learning process. So this is like what they call machine learning. Your brain is machine learning every moment. Okay, okay. So that is the beauty of that. And in during meditation, more synaptic connections are formed. They did a study. The study was done uh, in, in reputable American universities, and they studied 50 Tibetan monks. These people were expert deep meditators. Remember, deep meditation for a long time. And they looked at their brain, MRIs, and what did they see? The prefrontal lobe was very well developed. Anterior cingulate gyrus was increased in thickness. Lot of these brains, especially in cognition, have improved. Creativity, they have actually more dense. More dense means more connections. More connections means more intelligence, more creativity. Okay, and this can go on and on and on till you die. See, a baby when born has a head circumference of 20 inches. That is 50. No, sorry, not 20, 13 inches. When the baby is 3 year old, the head circumference is 20 inches. So the brain has increased in numbers. The cells are increased in number from age 1 to age 3. So in a human life, most important part of neurological development is first 3 to 4 years of life. Okay, newborn baby does not have that many cells as you do, but at the age of 3, the neurons stop dividing, and at the age of 3, you have your maximum. Your computer is fully loaded with all the hardware and all the memory. All right, next. Next slide, let's go. Okay, this is the autonomic nervous system. It just shows that, see, that is the brain you see here, and this is the spinal cord. And out to the spinal cord goes little nerves, okay, and they go to the all the parts of the body. I hope you can see it, but if you have a magnifying glass, you can see that it is going to the lungs, to the heart, to the intestine, every part of the body. Okay, and this autonomic nervous system has two parts. One is sympathetic, second is parasympathetic. Sympathetic says go go go, parasympathetic says no no no. And these sympathetic cords, they run along your spinal cord. These sympathetic cords finally end up into your brain stem. Now here is on the scale is that on the brain stem inside slide number 13. Now brain stem, from there the tracks go to the to the hypothalamus, and that's the end of the sympathetic system. In Ayurvedic terms, we call Ida and Pingala, but I do not really know how to correlate this, because then Sushumna Nadi, they say, goes through the spinal cord. To us, it is parasympathetic nervous system. So they are controlling, and it is true. There is no trunk like parasympathetic trunk in the whole body. The parasympathetic nerves go and flow through the spinal cord. And they basically every organ, like the heart, has nerves going from vagus. Vagus is parasympathetic, which slows down the heart. But it has got other nerves from sympathetic trunk, which accelerate the heart. So whole thing is to balance your body. Okay, go ahead. We're going to deal with that later on. Okay, this is not just dry anatomy physiology. There is an application to that. Go ahead. Next, please. Okay. Now we are come to the nitty gritty. This, please read that slide. It's not terribly important. The main problem, main intention of meditation is to make yourself happy. That is the whole purpose of human organism, right? Our whole purpose of life is to be happy, and meditation helps you do that. Next slide. Next, please. Okay, okay. Please go ahead. I think we went backward. Okay. Next, please. Anagata, next.
Anagata, go to 16.
Hey, these are different brain waves. What I'm trying to tell you, look at those waves and look at the one at the bottom. This is the wave that is recorded from a meditating brain. And look at the first one. See the difference? That is during the activity. Okay. So the point is your brain activity is diminished. Okay. Okay. Next one, please. Okay, please go ahead. Next one. How? Okay, this is of course better. Next slide. Otherwise, I will tell you whether you're doing it or right. Types of meditation. I think we just did the mindful meditation. I do mantra meditation. I chant Om under the breath certain number of times. Next, please. Go ahead, please. And now here we go. I will go one by one on different diseases as how it helps. Okay, it helps prevention and treatment of anxiety, neurosis, and depression. That is proven. Prevention and delay the process of senile dementia and Alzheimer and Parkinsonism. We will discuss cardiovascular. That I will come along with that. Respiratory, because it is stress-related asthma, that will help. Prevention of anything related to stress will be helped if you control the stress. Ulcers, hemorrhoids, Crohn's disease, IBD, they all are not exactly only by stress, but stress is a major etiological factor in causing these diseases. It improves executive function that I mentioned to you already and helps repair the damaged neurons. That is the biggest beauty that we know now. In the old days, we thought stroke means the neurons die. There is no recover, but now we know they do. And that is the best, I tell you, the best sunlight that people with strokes can see. Go ahead. Next one. Now we'll talk about Alzheimer's disease. Okay. Please go to the next slide. Next slide. Okay. 20% of seniors above 65 and 50% of seniors above 80 are affected. Now, most of us are very close on 80, so we are scared, right? But there is a thing. Some people who have a gene called E4 gene, if you have both E4 genes, your chances of developing the Alzheimer's is very early as 55. The first person who was described, her name was Auguste. Auguste was a German housewife, and her doctor was Dr. Alzheimer, and he described this syndrome. Now, just opposite of this, E2 is protective, is a protective gene. Beautifully, some people are 95 and they are perfectly fine. So they have this E2 gene. So everything is not so bleak. Some of you may have the E2 gene. Okay, next go. So the early symptoms are memory loss. Episodic memory goes first. Episodic memory means for the event. So our memory is of two types. Okay, one is explicit memory, second is implicit memory. Explicit memory म्हणजे तुम्हाला आठवतं तुम्ही where did you put your salt and sugar and where you hid your laddus. And episodic means in somebody's wedding you got this paitani, all that stuff, or somebody's wedding there was a lot of rain on that day, etc. And hippocampus is responsible for. Hippocampus is the one that is affected first. It is a part of limbic lobe. Okay, and then limbic lobe and prefrontal cortex. in this condition, the prefrontal cortex, I told you, it's like CEO of your body tells, don't do it. He will veto it. That inhibition is gone. So people with Alzheimer behave like their inhibition is gone. Then I'll come to the nun study. Nuns. This is a spectacular thing that happened in the progress of research in Alzheimer's disease. Um, in 1986, a doctor, his name is Dr. Snowden, he was in University of Minnesota. He decided and he found out that the nuns have a very, very low incidence of Alzheimer's disease. And so he recruited 687 nurses from different convents. And he studied there like this. This was a longitudinal study. Longitudinal means you go over many years. You follow this patient for years. And Dr. Snowden followed these women for many years. There was a very special thing about the nurses, nuns. The nuns have a very specific lifetime. Their life style is very sattvic. आपल्याकडे sattvic pattern. And what did they find? That all these nurses have a Mediterranean diet. Now, to be honest with you, all our Maharashtrian people have mostly Mediterranean diet. We eat little spicy stuff, but mostly our diet is no different. Mostly vegetables, very little. We don't eat any red meats, mostly. All right. So Mediterranean diet is well common factor. The second thing was that all these nuns they were very fond of gardening. Now, gardening is a good thing in favor of prevention of Alzheimer. The third thing was they did meditation. They were all required to meditate 20 minutes. Meditation, the Catholic Christian system learned meditation from Buddhist monks in Central Asia, because as you know, Emperor Ashoka sent a lot of Buddhist monks, and they built these monasteries all over the Central Asia, like Afghanistan, Uzbekistan, etc. And that's where they came in contact with the Christians, and they learned from us. So the institution of convents and monasteries has origin in India. That is something you should remember. So these ladies perform meditation 20 minutes, sometimes twice a day. They read good books, they had intellectual discussions, and of course their lifestyle was free of alcohol, sex, and smoking and drugs. So in all, their lifestyle was very stress-free. So Dr. Snowden, sometimes he moved or something happened. It was taken over by a lady doctor. Her name was Dr. Farnell. She was in the Northwestern University, and then she was transferred to University of Texas. So this study is still going on. The good ladies, these nuns, they donate their brains. And what they found, they did autopsies on women who were 104-year-old. 104-year-old. And they had no symptoms, there are no signs of Alzheimer's. Alzheimer's is the most diagnostic test for Alzheimer's is autopsy. Okay, so I will go further. And so the main problem with Alzheimer's also is stress. Let's go to next, because we are limited time. Go next. Go next. Okay, so this is the brain. On the right is a normal brain, and left is the brain of a person who has senile dementia or Alzheimer. See how small it is. They lose like millions of neurons every day. So ultimately your brain is like, instead of normally 1800 grams brain, becomes a 1200 grams of brain. Imagine how much brain is lost and the function is lost. Go ahead, next. Next, please. Okay, see, this is the hippocampus. See that I showed you? So this yellow thing that goes like this one is a hippocampus. Okay, and I will tell you why hippocampus is most important. And what happens, that stress literally eats into this hippocampus like a rat would gnaw into on a drywall or even cheese. So literally stress destroys the cells of hippocampus. Okay, go ahead, next. I'm coming to anxiety neurosis. Now let's see next anxiety neurosis. And please next one. Read this, okay? This has a very strong genetic tendency. And unusual, these people who have anxiety neurosis, they have a very unusual reaction to common stress situation. One time I went to a party and we were eating, and sometimes there was a crackling noise outside. So everybody thought, oh, this is 4th of January, 4th of July, so there are fireworks. The 4th of July. But their young daughter say, oh my God, go to the basement. They said, why? There is shooting going outside. Somebody is using machine gun to kill people. Now see, that is the anxiety neurosis. These people react to this in a most exaggerated way. And why this happens is mostly 50% genetic. In genetics, in terms of Vedantic, is carrying on your subliminal impressions of the subtle body to the next life. Okay, that's what is genetic is. So these people who have suffered generally are born with anxiety neurosis right from the childhood. There is strong environmental factors, like there is a stress situation, divorce, broken families, single motherhood, drug situation, disease situation. All these are stresses, and that could cause a child to be more manifest his anxiety neurosis gene. But it originally comes from there. It coexists with depression and OCD, obsessive compulsive disorder. And people suspect limbic system pathology because emotions are controlled by your hippocampus and limbic system, right? And a neurohormone glutamate may be responsible because it is the one go kind of neurohormone. And remember two names, epinephrine and norepinephrine and cortisol. We'll come to that later. Okay, these anxiety neurosis treated by three ways. One is medication, second is by meditation, and third is by cognitive behavioral therapy. So there is no doubt now that meditation helps anxiety neurosis because it creates a wall between outer stress and your mind. Like the mind becomes apavargi, not bhogavargi. All right. Next we go next, please. This is the um, source of all the stress. Next slide. I will show you. The next slide is more vivid. Go number 27. Wait here. Okay. So this is called hypothalamic pituitary adrenal axis. See, your brain, when it is under stress, it stimulates this hypothalamus here. Hypothalamus is a part of the brain which is just under thalamus, and thalamus is on the underside of the cerebral hemispheres, and it secretes a hormone. It's called ACTH, stimulating hormone. The ACTH stimulating hormone goes to the pituitary gland, and it stimulates ACTH. ACTH stands for hormone, adrenocorticotropic hormone. This is sent by pituitary to the adrenal gland. You see this, there is an adrenal gland. It is just above your kidney. There are two adrenal glands. They produce the cortisol. The cortisol, the same thing that you get a cortisone shot in your joint, that is that cortisol. When it is small, it is good. But if constantly producing, it creates havoc in your body. Okay, and it also produces epinephrine, norepinephrine, which are sympathetic thing, which go. So people who are on go are more likely to suffer from hypertension and diseases related to that, stroke and heart attack. Next one. So the whole basis of this depression and anxiety neurosis is stress. And stress is controlled by your meditation, because meditation does create a wall between the stress factors and your body or your mind. As you know, Anagata, I told in the beginning that our whole life we are bombarded with sensory onslaught. We wake up in the morning and nobody lets you calm down. Somebody calls, somebody sends you a text message, somebody sends you a WhatsApp thing, and that disturbs your mind, and it is all useless. it really is useless. And then you're thinking about it, thinking about that, and you waste your time. It causes anxiety in you. It is anxiety in every normal mind. Imagine what type of person with anxiety neurosis. Depression is often an offshoot of anxiety neurosis. The basis of depression nobody knows. It is also highly genetic in origin, but it can be triggered by factors like somebody loses job, somebody loses a partner. So it causes that's called a temporary or reactive depression. But somebody is a very different. It's a clinical depression which needs medication, and clinical depression is terrible. They feel like they are in darkness. They have no hope. They are hopeless. They don't have appetite. They don't sleep. They don't. Uh, they don't sleep well. Sexual desire is suppressed. They don't feel like doing anything and commit suicide. So depression is something that is very much common in teenagers, especially female teenagers, and more in Indian female teenagers. And almost 40% of the senior citizens, we suffer from depression. Why do we suffer from depression? A lot of things happen. We retire, we lose sometimes our partner, we have illnesses which are chronic, and that is you see no hope, and that causes the depression too. But that is much easily treatable with medications. But people, those who have inherent depression, they have get depressed with easy things, like everything is fine. But somebody, there was a shooting in Florida where 6 people get killed by a crazy man, and they get depressed. And this depression is coming from inside. They have a gene, okay, and that is also hard to treat. But it originates into your hippocampus and limbic system. And limbic system is repairable by meditation, according to our present research. Remember, limbic system is repairable, especially the hippocampus. They have discovered that new cells can be formed. These synapses, which are healthy, are repaired with meditation, and that could be the bright light in this case. Now next we go, and the last part of this thing is, go ahead to the slide of specific learning disability. This is beautiful. Look at this. Look at the next slide. What is the specific learning disability? See, there are a lot of children who don't do well in school, and they hear well. They are not retarded. They hear well. They see well. Their family is good, but they still don't do well in school, and nobody understands this. And they are labeled sometimes as mildly autistic. That is that is just bad. They should not be labeled as autistic. They are dyslexic. Dyslexic, I will tell you what is dyslexia. Dyslexia means reading disability. Okay. There are other types of disabilities, learning disabilities. One is dyslexia. The second is dyscalculia. They are very weak in math. Third is dysgraphia. Their spelling is terrible, because I told you that these have different nuclei, different centers. Okay, there is a center for mathematics. There's a center for spelling, center for even there is a center for talking properly. They have discovered that some people आपण म्हणतो ना बोलण्याची अक्कल नाही, that thing, and that goes very commonly with people who are Asperger. Next slide, I'll show you where are the centers. Okay, go next slide, please. Look, there is less neuroactivity in Wernicke's area and visual cortex. Brain regions are physically smaller in dyslexic. Connection between Wernicke's area and Broca's area are faulty. Next one. I will show you where are these areas. Please go next. See this. See Broca's area. Broca area is a motor speech. The center is in the frontal lobe. See the front part of the lobe, right somewhere here. And Wernicke's area is right above your ear here. It is related to the hearing, speech, and all that. So when there is communication between two are defective, or there are less number of cells in these two areas, this child suffers from specific learning disability. He is not retarded. He is just a normal human being. But these centers are weak. And now, how you gonna fix this? They have tried medications, they don't work. They have tried alternative teaching methods, like bypass the reading method of teaching. That's the auditory method of teaching, like listening to tapes. And yes, but all of these medicines, all these modalities of teaching these people with specific learning disability have not been very effective. Most parents, I tell you, and I'm sure you guys have grandchildren who are suffering from some kind of academic deficiency and academic insufficiency, and you wonder what's wrong with them. And everybody blames the mother and father, right? Usually they do. Anyway, next one. Next slide, please. Okay, these are my references, but I'll illustrate about the how can these children be helped. That's your question, right? A person who is Alzheimer's patient is 78-year-old, and his horizon is, to be realistic, his horizon is small. But this child is a 10-year-old. How are you going to help him? That breaks your heart, right? Parents' heart, grandparents, everybody who loves them, it breaks their heart. How can I help this child, right? Now, everything is not dark. There is always a hope. What is the cause? I showed you. The connections between these two areas, Broca's and Wernicke's, are not right. They are synapses. They are association cortex. They are the tracks going from front to back, like this. Suppose here is the Broca's area and here is the Wernicke's area, and those blue lines, these are the tracks, are not well formed. What can we do once not well formed? When are they formed? They are formed in the first 3 to 9 years of life. What can we do? Is A, reduce the garbage that is thrown at them, sensory onslaught. And part of it is, of course, video games, excess video games that can cause compromise, because in video games you are using everything else. You're not using this. You're watching too much TV. Maybe you are just watching it, but you're not learning anything. So there is another thing. How can meditation help here? That is the bottom line. And meditation, if you prove meditation builds up more synapses, it will heal. But how can a 10-year-old be made to meditate? This is the $1 million question, right? So I had this question. Luckily, I came across a podcast. The podcast said our Surgeon General Vivek Murthy had conducted a study in the public schools of San Francisco. And he made these children who are like fourth grade, fifth grade, meditate for about 5 to 10 minutes, only 5 to 10 minutes. And they found a definite reduction in hyperactivity, school grades, and generally abnormal behavior. So something can be done. Now the question is how you teach a child who is 8-year-old meditation. Even we cannot sit still. But I'm again optimistic person. I feel that if a puppy dog can be trained to be toilet trained, why not a 9-year-old intelligent boy? I do believe that. Anyway, in all ancient times, um, we used to have the Gurukul. Rishis used to bring in the boys at age of 8, and they used to teach them. What did they teach? How did they teach? We do not know. But there is something that could be done. That whole area, that whole sphere of education is completely unknown to us. And I wish, and I believe, and I'm confident that one day people will come with that, teaching these children some other ways in which even specific learning disability, though not completely cured, but will be somehow uh, diminished or some mitigated in that way. And I think I'm now thanking all of you again for listening to me for 45 minutes. And I sincerely believe that you enjoyed my talk and ready for questions if I can answer all of them. Thank you.
नगाताई, तुम्ही आता ना शेअर स्क्रीन बंद करा, स्लाइड्स बंद करा.
He shouldn't have. Thank you. स्लाइड असला की ठीक असतं.
थँक यू. खूपच छान माहिती सांगितली डॉक्टर लोथे. जर कुणाला काही प्रश्न असतील तर विचारा. एक प्रश्न असा होता चॅटमध्ये की आर देअर एनी स्पेसिफिक फूड्स टू हेल्प विथ दिस?
You know, I tell you, the only good food that helps the babies to improve their neurological function is breast milk. Breast milk is the only medicine, but that is not good beyond certain age. You know, breast milk has those special cerebral lipids which improve the development of the neurological system. So, I and beyond that, giving multivitamins and all that time, it's just very questionable. Very questionable. They may Some medicines will prevent hyperactivity. I agree with that. Especially some artificial colors and flavors are known to cause hyperactivity. But improving the brain function and memory, even at our age, all neurologists say that is a major scandal, major fraud that runs into your health food stores.
थँक यू. दीपाने हात वर केलाय. गो अहेड.
हो, तर प्रश्न असा आहे की जस्ट सिटिंग विथ क्लोज आयज इज दॅट इनफ और वी शुड डू एनी पर्टिक्युलर टेक्निक, वी शुड फॉलो पर्टिक्युलर टेक्निक फॉर दिस?
There has to be a technique because even sitting down with closed eyes, closing the eyes, it's very beneficial. It shuts off lot of stimuli that will disturb your mind. Agree?
हो
Then
हो.
shutting the ears, another
Yes.
one third of your sensory onslaught is blocked. Isn't that good? So it
हो
certainly helps. But ultimately, it is your mind which is playing games on you, and you have to control the mind. And the mantra controlling the mind, Patanjali says Om, and I
ओके.
found it is useful. And you know, right? You decide that I'm going to say Om in the mind, or even a little bit under the breath, and just focus on saying Om properly. Not like Om. Oh, no, madam, no. Just say Om properly, and you go into a rhythm. There is a rhythm you fall into, like a classical music. You go to a classical music concert. What do you feel? तुम्हाला तिथे तंद्री लागते.
हो
तंद्री लागते त्या तबल्याची, सितार,
हो
त्या माणसाचा आवाज, नाही का? आणि
हो.
म्हणून मला ऑनेस्टली वाटतं की you can control your mind with one of these things. Om is one of the things. And some people give mantra, उदाहरणार्थ TM मधले लोक ट्रान्समेडिटेशन, ते प्रत्येकाला मंत्र देतात. कसला
हो
मंत्र आहे ते कोणाला सांगत नाही. ते
हा
$300 घेतात.
हो
काही लोकांना फायदा होतो, पण ते $300 न देता तुम्ही पुष्कळ काय करू शकता.
हो. नाही, मग इथे कोणीतरी टेक्निक शिकवतं का आपल्या या प्लॅटफॉर्म वरती?
इथे
तर
इथे
मग कारण माझी
पुष्कळ
इच्छा आहे की असं प्रॉपर टेक्निक शिकून मग करायला हवं. तसं मी रोज बसतेच डोळे मिटून.
हो. नाही, काही हरकत नाही. तुम्ही असं करा की आपल्या इथे there are quite a few people who can teach you meditation. You
अच्छा.
can best go to one of these good ashrams like Chinmaya Mission in Washington. मी कुठे शिकलो? मी शिकलो ते स्वामी तदात्मानंद म्हणून पेन्सिल्व्हेनियातल्या
हा.
स्वामी दयानंद स्वामीच्या आश्रमात स्वामीजी होते. पण ते
अच्छा.
एकदा आले तर आम्ही आमच्या मित्रांबरोबर तिथे गेलो. त्यांनी मला ते शिकवलं. ते शिकल्यानंतर माझी पाठदुखी बंद झाली. बरं.
अच्छा.
माझं वागणं सुधारलं असं मला बायको सांगते.
हा.
त्याचा नक्की फायदा होतो. तर आय
हो
स्टार्टेड इन्क्रीजिंग आणि स्लोली वाढवता आता मी 45 मिनिटं सहज करतो मेडिटेशन.
हो
केल्याशिवाय बरं नाही वाटत.
हो
हं.
हो. तर ओके. म्हणजे मला इथे काय पुष्कळ प्लॅटफॉर्म आहे, तर कुठे जाऊन शिकायला हवं असं म्हणजे आता?
मी तुम्हाला एक क्रायटेरिया सांगतो तुम्हाला. जे लोक
हा
पैसे मागतात ना,
हा.
त्यांच्याकडे जाऊ नका.
अच्छा. ओके.
चांगला गुरु पैसे मागत नाही.
हो बरोबर आहे. ओके.
थँक यू. डॉक्टर लीना पत्तरखिने, बोला. तुम्ही विचारा.
नमस्कार डॉक्टर लोथे. खूपच छान तुमचं प्रेझेंटेशन ऐकून मला खूप बरं वाटलं. मला याच्यामध्ये एक गोष्ट विचारायची की तुम्ही डिस्लेक्सियाचे जे सांगितलं 3 प्रकार, की मॅथमॅटिकल डेफिशियन्सी किंवा रीडिंग डेफिशियन्सी किंवा स्पीकिंग डेफिशियन्सी. तर आपल्याकडे लहानपणी जे परवचे आणि पाढे आणि हे श्लोक वगैरे म्हणवायचे. इज देअर एनी कनेक्शन की प्रॅक्टिसिंग दॅट रुटीनली एव्हरी डे वुड दॅट मेक अ डिफरन्स इन दोज सिनॅप्सेस?
अच्छा. आपल्याकडची मॅथमॅटिक्स शिकवण्याची पद्धत वेगळी आहे आणि फार प्राचीन काळी जे मॅथ शिकवायचे ती पद्धत वेगळी होती. या देशात शिकवतात ती पद्धत पूर्ण वेगळी आहे. त्यांनी हे कनेक्शन्स होतात का, हा संशोधनाचा विषय आहे. मी तुम्हाला डेफिनेटली येस किंवा नो सांगू शकत नाही, परंतु कॉमन मॅथमॅटिकल प्रॉब्लेम सॉल्व्ह करण्यात पाठांतर डेफिनेटली कामाला पडतं. कुठलीही भाषा जर तुम्हाला मास्टरी करायची असेल ना, तर पाठांतराशिवाय दुसरं मार्ग नाही. आपण लहानपणी होतो, आपल्याला एक धडा असायचा, आठवतं का तुम्हाला? तर तुम्ही इंडियात वाढले की मला माहित नाही, बहुतेक तुम्ही
मी
वाढले असाल
इंडियातच
इंडियात.
वाढले. नाही, मी
नाही गेलं?
इंडियातच वाढले.
आणि एक धडा संस्कृत असो की हिंदी असो की इंग्लिश, शेवटी एक हे असायचे 10-12 शब्द असायचे आणि ते तुम्हाला पुढच्या वेळेला पाठ करून जावं लागायचं, आहे की नाही? त्याच्यावर परीक्षा सुद्धा व्हायची की या शब्दाचा अर्थ काय आहे, नाही का? तर
बरोबर.
पाठांतरामुळे डेफिनेटली लँग्वेजमध्ये फायदा होतो. मी तुम्हाला माझा अनुभव सांगतो. मी मॅट्रिकला होतो ते 1961 साली. तर तेव्हाची पुस्तकं अतिशय कठीण होती इंग्लिशची. तर त्यात त्याचा एक धडा होता. त्या धड्याचं नाव होतं गॉड इज. कोणी लिहिला असेल हा धडा? महात्मा गांधींनी. महात्मा गांधींनी एकदा लुई फिशर नावाच्या अमेरिकन जर्नलिस्टशी त्याच्याबद्दल डिस्कशन केलं आणि ते त्यांनी त्या हरिजन नावाच्या मासिकात छापलं. त्याचं नाव होतं गॉड इज. देव का आहे, त्याचे 10 पानं धडा होता, अत्यंत किचकट. मी माझ्या वडिलांजवळ कंप्लेंट केली. ते म्हणे, अरे पाठ करून टाक, पाठ करून टाक, आहे ना, पाठ करून टाक. मला हसू आलं, पण आपल्याकडे काय बाबा वाक्यांप्रमाणे बाबांनी म्हटलं की केलं पाठ. मी खरोखर धडा पाठ केला आणि त्याचा काय फायदा झाला, मी मी तुम्हाला सांगतो, माझं इंग्लिश परमनंटली चांगलं झालं. इतकं की युनिव्हर्सिटीच्या परीक्षेत तुम्हाला इंग्लिशमध्ये डिस्टिंक्शन मिळतं का? इंग्लिशमध्ये डिस्टिंक्शन मिळणारे किती लोक आहेत तसे? मी एकटा माणूस होतो आणि त्याचं क्रेडिट माझ्या वडिलांना देतो मी, कारण त्यांनी मला हे धडे पाठ करायला लावलाय आणि पाठांतराने डेफिनेटली लँग्वेजमध्ये फायदा होतो. दॅट इज डिफरंट. पण मॅथ कन्सेप्ट वेगळ्या असतात. यू हॅव टू रिअली अंडरस्टँड देम.
ओके.
मला
आणि मला
याच्यावर एक छोटीशी कॉमेंट आहे पाढ्यांवर. मी माझ्या मुलांना लहानपणी पाढे शिकवले आणि त्यांना येतात आणि तिथेच वाढलेले आहेत. पण त्याचा प्रॅक्टिकल व्ह्यू माझा असा होता, एखाद्या गोष्टीची जर गोडी लागायला हवी असेल तर आपल्याला एखादी गोष्ट पटकन येते असं त्या लहान मुलाला वाटलं पाहिजे. सो द ॲडव्हान्टेज ऑफ टीचिंग पाढे वॉज बेदुने 4, बेपंचे 10 हे त्यांना पटकन यायचं. त्याचा त्यांना सोशल लाईफमध्ये असा उपयोग होतो की अरे हा, मला येतं की हे, आणि असं वाटल्यामुळे त्या मुलाला त्या विषयाची गोडी लागते. पण हे जरी खरं असलं तरी मी स्वतः अतिशय उत्तम आहे मॅथमॅटिक्समध्ये. माझ्या हेही लक्षात आलं. ती मुलं मोठी झाली माझी, आता दे आर ॲडल्ट्स, आणि जेव्हा त्यांना कॅल्क्युलस शिकवायची वेळ आली तेव्हा दॅट नॉलेज ऑफ पाढा वॉज नॉट युजफुल. जरी त्यांना तेव्हा गोडी लागली तरी त्यांना ते कॅल्क्युलस मधलं त्यांना पटकन कळायचं नाही. तर माझ्या 2 मुलांमधला फरक एवढा की माझ्या मुलीला ते शिकायची अतिशय इच्छा होती, त्यामुळे तिने माझ्या मागे लागून लागून मला कॅल्क्युलस रोज घरात रडारड. मी बाहेर काम करते, शेवटी मी रोज तिला एक वेळ द्यायची ठरवली आणि तिला कॅल्क्युलस शिकवला. मी काय केलं बेसिकली की त्यातल्या ट्रिक्स शिकवल्या की एखादी गोष्ट कशी हँडल करायची, त्यामुळे तिला उत्तम मार्क पडले. मुलाला काही तशी इच्छा नव्हती, त्यामुळे त्यांनी काय तो शिकला नाही. सो हा जो फरक असतो की एखादी गोष्ट आपल्याला पटकन आली की आपण चांगलं आहे असा आपला गैरसमज असतो, त्यांनी मुलांचा कॉन्फिडन्स वाढतो. हा त्यातला फायदा आहे.
मला पूर्ण म्हणतात तुमचं पटतं की सुरुवातीला काय असतं की जेव्हा तुम्ही सोपे प्रश्न असतात, अरिथमॅटिक विशेषतः, ते तुम्हाला पटापट आले की तुम्हाला खात्री वाटते की अरे वा छान, आणि त्याच्यात पाठ असण्याचा खूप महत्व आहे. आणि खरोखरच सुरुवातीच्या ग्रेड्समध्ये ॲटलिस्ट ग्रेड लेवल म्हणजे बिलो हायस्कूल इज सर्टनली युजफुल.
आता अजून लोकांनी हात वर केलेले आहेत. नूतन पवार, गो अहेड.
नमस्कार डॉक्टर लोथे. तुमचा कार्यक्रम खूप आवडला. एक पर्सनल गोष्ट सगळ्यांबरोबर शेअर करायची होती. माझं शिक्षण महाराष्ट्रामध्ये झालं, मुंबईमध्ये. बट आय वेंट टू अ सेंट्रल स्कूल. सो माझी माध्यमिक जी भाषा होती ती मी हिंदीमध्ये शिकले. माझे सगळे विषय हिंदीमध्ये होते. आणि हिंदीमध्ये सेंट्रल स्कूल्समध्ये देअर्स अ लॉट ऑफ प्रेशर. इट्स ॲट अ हायर लेव्हल. आणि माझी जी बहीण होती, वी हॅड अ सिमिलर प्रॉब्लेम. It was after the fact that she found out that she has dyslexia graphica. But it was not detected when she was in school. जेव्हा ती 5वीत होती, it was not detected. She had to repeat it and again got labeled that she is bad in math. But because of a loving family upbringing, our schools were changed. We found a school that was, more supportive and less drill sergeant like, right? She was able to graduate. She has actually now holds a double master. She Mumbai University मधून तिने social work मध्ये gold medalist मिळवलं. And then she also went on to do, just out of pure interest, she did masters in Urdu, and she's both shaira and a lekhika. So yes, in Indian setting, I think many of the elements that kids undergo are not detected, and as a result, I think a lot of the kids have a handicap, which is really sad. And आता इथे, after coming to America and bringing up kids, and I'm thinking the kids here are really extremely lucky that we can assess the problem, identify, intervene, and have them go to living fulfilling lives. So thank you for bringing that attention. And I hope something similar is done in India, so to help our Indian kids.
मी जेव्हा मॅट्रिकला होतो, तर 9व्या वर्गात मी का गव्हर्नमेंट स्कूलमध्ये अकोल्याला होतो. तर 9वीमध्ये त्यांनी आम्हाला सगळ्यांना ॲप्टिट्यूड टेस्ट दिली, की या मुलाला, कारण आपल्याकडे 9वीमध्येच, म्हणजे विदर्भात 9वीमध्ये तुम्हाला चूज करावं लागायचं की बायोलॉजी की मॅथमॅटिक्स की ह्युमॅनिटीज. तर त्यांनी आम्हाला टेस्ट दिली. त्याच्याकरता मुंबईहून एक ग्रुप ऑफ सायकॉलॉजिस्ट आले आणि सगळ्यांनी टेस्ट दिली आणि त्यांनी सिलेक्ट केलं की ही मुलं मॅथमॅटिक्सला योग्य आहेत, ही मुलं मॅथमॅटिक्सचं चांगलं नाही, यांना बायोलॉजी किंवा ह्युमॅनिटी द्या. सगळ्यात कमी ज्यांचं कॉम्प्रिहेन्शन होतं त्यांना ह्युमॅनिटीजमध्ये देण्याचं रेकमेंडेशन करण्यात आलं. आई वडिलांना आवडत नाही ते पुष्कळदा, पण ॲटलिस्ट दॅट वॉज स्टील डन. आय थिंक आय प्रॉब्ली डन इन इंडियन स्कूल्स नाव. वी आर सो ॲडव्हान्स नाव इन इंडिया. नेक्स्ट
थँक्यू
प्रियांका.
सो मच. आपण म्हणजे लहान मुलांचं ब्रेन डेव्हलपमेंट आणि येणारे प्रॉब्लेम्स आणि हाऊ टू डील विथ इट, किंवा हाऊ टू लुक ॲट इट, व्हॉट पर्स्पेक्टिव्ह टू अडॉप्ट, हा खूप छान टॉपिक आहे. आपण नक्की याविषयी बोलू पुढच्या सेशन्समध्ये. अजून 3 हात वर आहेत. आपल्याला वेळ खूप कमी राहिलेला आहे. तर जर क्विकली तुम्हाला कॉमेंट करायचं असेल तर गो अहेड. प्रतिभा मुधोळकर.
Thank you. I really loved this presentation. I just wanted to ask, because the speaker said he's doing 45 minutes Omkar meditation. Can you just show us the glimpse of it, please?
आता ते ओम म्हणताना पुष्कळांना हाच प्रश्न असतो की ओम कसा योग्य प्रकारे म्हणायचा. तर आपल्याला सांगतात की ओम याचे 3 कॉम्पोनंट आहे, आ, उ आणि अम, आहे की नाही. तर त्यातला प्रथम, टेक अ डीप ब्रेथ. फर्स्ट थिंग, बी स्लो. ओके, घाई करायची नाही, बिलकुल नाही. टेक अ डीप ब्रेथ अँड देन लेट मी से व्हॉट आय डू. बट रिमेंबर, आय डू मनात करतो, मोठ्याने आवाज करत नाही त्याचा मी. सांगतो तुम्हाला, मोठ्याने जेव्हा असेल, मी पूजा करतो, संध्या करतो, तेव्हा अशा प्रकारे ओम म्हणतो. टेक अ डीप ब्रेथ अँड देन आमचे सच्चिदानंद गुरुजी, तदात्मानंद गुरुजी, त्यांनी सांगितलं की जेव्हा तुम्ही ओम म्हणता ना, तेव्हा तुम्ही दीर्घ करा आणि लिफ्ट युअर डायफ्राम अप, बिकॉज इट इज एक्झलेशन. दिस इज एक्झलेशन, लाईक हो, म्हणजे तुमचा डायफ्राम वर गेला पाहिजे. जर डायफ्राम वर जात आला ना तर दिस ओ बिकम्स लॉंगर आणि नंतर मग करताना ओठ बंद करा, म्हणजे ते क्रिएट व्हायब्रेशन्स. आणि जेव्हा तुम्ही व्हायब्रेशन तोंड बंद झाल्यामुळे ते गोट इन टू युअर चेस्ट आणि यू विल ॲक्च्युअली सेन्स दॅट यू कॅन मुव्हिंग दोज व्हायब्रेशन्स फ्रॉम द चेस्ट डाऊनवर्ड्स. तर पूर्ण शरीरात ते व्हायब्रेशन्स पास करा. आणि खरोखरच की 4 की 5दा म्हणाले आणि तुम्ही तर एकदम रिलॅक्स होता. एकदम मला तरी वाटतं बा की मला 5-6दा ओम म्हटलं की एकदम रिलॅक्स होतो मी. मग
Yeah,
सगळे वाईट
I just want uh,
सॅडनेस
the-
जातो. हं?
I just wanted to know की आधी आता समजा दीर्घ ओम करायचा आहे तर दीर्घ श्वास पण घ्यायला पाहिजे ना.
अर्थातच हो, घ्या ना थोडं.
मग दीर्घ श्वास घ्यायचा तो अगदी बेंबीपर्यंत घ्यायचा म्हणजे पोटाच्या ह्याच्यापर्यंत घ्यायचा का?
हो, अगदी. टेक अ डीप ब्रेथ, म्हणजे त्यात तुम्ही पुशिंग द डायफ्राम डाऊन. आपल्याला
मग ते
सबनीस गुरुजी शिकवतात ना प्राणांच्या क्लासमध्ये. ते सांगतात ना प्रत्येक वेळा तुम्ही भस्त्रिका करता किंवा तुम्ही कपालभाती करता, प्रथम तुम्ही डीप ब्रेथ घेता दरवेळेला. टेक अ डीप ब्रेथ. This way you are expanding your chest and getting a lot of oxygen in your body because
Yes.
you are opening the lung bed. Lungs are expanded and you get twice more oxygen when take deep breath and then do the Om.